the second biggest objections we hear from families is the problem is only mental health. And how do we handle that? Now, what I can tell you is that we do about 400 interventions a year. Of those 400, on average, only 2 cases per year turn out to be only mental health with no substance use, past or present. 90+% of families call our office and swear that's what it is. Why do they do that? Well, I can tell you why. And this is not, again, a Mike Lavertyism or a family first interventionism. This is what I hear from healthy families and our aftercare department and why they wanted it to be mental health and not addiction. Because it's easier to digest and it justifies enabling. It's a lot harder to explain why you gave a fentanyl addict or a meth addict $50, or why you're letting a crack user, an alcoholic, live in your home rent-free. But when you can hide behind a bipolar diagnosis, then you can do those things and feel less, and don't feel as guilty in doing so. So before I go any further, I am not here to discount mental health disorders that your loved one may have. What I'm here to tell you, and if you go on our website, Excuses Families Make to Not Do an Intervention, you may already be there, you will see quotes from the WHO, the American Association of Addiction Medicine, the DSM, et cetera, where it states, and in textbooks from that I have, that no clinician at any point in time can diagnose a mental health disorder when any substance use is present, even at minimal levels. So what we're saying is that the interventionist job is to get your loved one to treatment. Interventions are about resistance to treatment, not the drug of choice or the mental health diagnosis. So we need you to get off of, is it bipolar, is it mania, is it schizophrenia? We have to get with the family to help you guys identify why they're not accepting help and advocating for their own care, regardless of the ailment. Our interventionists we send you will not be their primary clinician, and they will not be the treatment center. Their job is to help you guys get to a place of strength and hope and boundaries and accountability, to be educated on substance use and mental health and behavior so that you can make informed decisions on what you should do next that'll increase the opportunity for your loved one to accept help and be far less resistant to treatment and advocating for their own care. So families always want to tell us that the problem is mental health. What are you going to do differently? And of course, depending on the background information you give us, there's a lot of things we may do differently. And at the end of the day, we need to get them to treatment so they can be stripped of any and all drugs or alcohol, if in fact that is present, so that the clinicians at the facility could bring them to a baseline and they can rebuild from there so they can get a true diagnosis. And lastly, a lot of people want to throw out, well, they've been diagnosed with this, that, and the other since the age of 5. Guys, it doesn't mean it's an accurate diagnosis. There's a link on our website where organizations such as ASAM and the DSM explicitly state how overwhelmingly inaccurate doctors are in diagnosing and prescribing psychiatric medications. They spend very little time with your loved one. Most of them make the diagnosis in a time of crisis with a short stay in a mental hospital or through a family physician and a routine office visit. So just because I had a diagnosis of bipolar early on doesn't mean that's accurate later in life. And there's another page on our website under the services section about mental health interventions and dual diagnosis, and I have a personal experience on there with my own family member that you may want to watch about how they were diagnosed early on, and when we took away the insurance, became a self-pay client, all of a sudden the diagnoses were never added, and they were no longer discussed, and they were treated based on their behaviors and things that they needed to do to cope with life. So again, is it mental health? I don't know. Is it addiction? I don't know. But what I do know is they're not advocating for their own care, and they are resistant to treatment, and it's our job to help them get there.